It's really the miracle drug of acne. I see a lot of parents that come in telling me that their child has completely changed because of their acne. The acne in teenage groups impacts as much as disabling diseases like epilepsy and diabetes.
All of those things are bringing out this nasty acne.
That's going to leave an irreversible mark.
If you're starting to get scarring,
It's a game changer for acne.
today we're talking about acne, specifically teen acne.
We're going to deep dive into what causes acne, some commonly held myths, and how you can act on your teenagers or your own acne with some good treatment approaches. I think we kick it off with the basics. What is acne, Sam?
This is a really great question because a lot of time when people come in to see me and I say, oh, you've got acne, they're, oh, no, I don't have acne, I just have breakouts. Well, acne encompasses everything you can think of when it comes to breakouts in the skin. So blackheads and whiteheads, little pimples, nodules, cysts, even that really excessive oily skin, which we call hyperseborrhea, can sometimes be encompassed in the term acne.
The word acne quite medicalizes it, but it does include so many different lesions in terms of what we as dermatologists call it. So we often look for things like blackheads and whiteheads, which don't often look like much, do they? They feel bad, but they don't look terrible.
Yeah, and they can be the hallmark. So they can be the first thing that you see in like a 10 or 11-year-old. They get little blackheads and whiteheads across the forehead. And that to us is like the onset of puberty. And
it's a clue that something's happening in the skin that potentially isn't good for it. What do you find the most patients are coming in complaining of?
When people are coming in with acne, the biggest thing that they're talking about is the appearance, the way it looks, and the way it makes them feel. And I think compared to when we were teenagers, that has become quite exponential with the advent of social media. Everyone's visible all the time. People are very self-conscious. And so that self-confidence for teenagers in such a difficult time of their life is probably the overriding issue when it comes to acne. I mean, it's not the only thing that bothers them. I'm sure that you've got teenagers.
I have.
What did they complain about?
I think you're absolutely right. It is a huge impact on confidence at this age group. I see a lot of parents that come in too telling me that their child has completely changed because of their acne. They're pulling out of sports. They're low self-esteem. They're losing or changing their friendship groups, all because their skin isn't looking how it used to look. So it's actually, even there's been a lot of evidence and literature studies done showing that acne in teenage groups impacts as much as disabling diseases like epilepsy and diabetes. So it's a disease that's really on the rise in terms of recognition because of social media. But I think it's a great disease to treat because we can really effectively treat it.
Yeah, it's really rewarding.
Yeah.
Now, speaking of parents
Yes.
and thinking of the causes, what do you see about the causes of acne?
It's all about that sebaceous gland unit in the skin, and that's usually under a lot of genetic control. So I often say, look at your mum and your dad. Did they have acne? Look at your big sisters and brothers. If they do, you've got a pretty decent chance that that sebaceous gland is going to be overstimulated as you come into puberty. And the signs of that are all those lesions we talked about, so the blackheads and the whiteheads. That's the number one cause. It's nothing that generally you're doing, putting on your skin, eating or drinking. Having said that, there was a condition we were talking about earlier that you mentioned. That's a big driver in today's social media.
Mecca face. Sorry, my apologies, Mecca. It could be any number of faces, but kids, teenagers in particular, are just slathering themselves with products. Way too many at the same time.
Yeah.
They're switching and changing out things. They're irritating their skin.
Yeah.
And all of those things really are bringing out this really nasty, occlusive kind of acne. Or at best, it's not treating it. And at worst,
it's really undoing any skin barrier and any restorative potential that the skin has. So I think when we're treating acne too, it's often really good to simplify things. I often say you only need three elements of your routine, and that's a decent cleanser, a moisturizer you like using, and a sunscreen that you'll use every day. Is that similar to what you? Absolutely, keep it really simple.
Yes, well, I think when it comes to the cleanser, the big thing I say to people, that's on your skin for all of about 20 seconds. It does the least amount in your skincare regime, but can do the most damage. So if you're using beaded exfoliants, really drying products, highly fragranced products that are irritating your skin, then that's a bit of a no-go. You want to keep that simple, a really simple basic cleanser.
Yeah.
And there's just a myriad of those things to choose from. Your moisturizer, something nice and light, not too thick, and then obviously your sun cream daily is absolutely imperative. And I think if you stick with that for 4 to 6 weeks, things should really start to settle down. And if you're not getting anywhere, what would you maybe do next?
I think then it's probably a time to reach out maybe to your pharmacist or your GP and have them have a look at your products, check the ingredient list and check they're doing the right thing by your skin. But I think you raise a really good point, that 4 to 6 week timeline. I'm finding a lot of my patients really expect an instant result the next day.
And that's our generation.
It is. That's
we're dealing with.
Another new side effect of all the social media. So I think educating that our patients and our kids that you really have to put in that time investment. You have to develop the habits for the skin to play out the benefits. So I think that's a really important thing to learn. What about myths? I'm seeing a lot of myths around acne and dirty skin. Do you have patients say that, is my skin dirty?
I'd say there are a lot of myths around things like that. So in particular, hygiene.
Yeah.
So kids will come in with their parents and they're saying things like, oh, he's changing his pillowcase every single day. I'm washing all the sheets. He's using a different towel every time he has a shower. I'm constantly at him to wash his face. And I think, of course, we don't want excessive oil buildup and we don't want to use a pillowcase that's been on the bed for 2 months, but we don't need that overkill. Acne is not driven specifically by hygiene. It's driven by the hormones that come into play as you enter those adolescent years.
And so having that good routine is helpful, but at the same time, playing football is not going to cause your acne.
No.
Another myth I often get thrown is that having dirty hair, I don't wash my hair enough, is that causing my acne? How do you approach that?
I haven't really got that one before. Okay. Maybe people with fringes have mentioned oil on their forehead. Yeah, or hats,
the school hats. And is it from wearing my school hat?
Well, I think your hair gets oily by the same reason that your skin is getting oily, and that's the hormones coming in and activating, as you said, the oil glands before. Yeah. So I don't think one is that oily hair is not causing acne. Yeah. They're just all a byproduct of the same issue.
And I think it's really helpful to reinforce that it's not your hat, it's not the football game, and it's not often the foods you eat that is causing your acne.
Oh, speaking of foods, if there is, like obviously it's great for people to have a well-balanced, healthy diet. We want to minimise some certain foods in our diet. What kind of things would you tell people?
Yeah, well, very over-processed foods and things with a very high glycemic index, so very highly sugared foods, they can often wreak a bit of havoc with our hormones and in a small percentage of severe acne that can be contributory. But I think in the majority of cases, a healthy diet is all you need to promote good glowing skin.
Yeah, I'd probably tell people, if I had to say, oh, listen, cut out these things, there's a percentage of people that dairy impacts on, not everybody. So if you cut that out for 6 weeks and it didn't make a difference to your acne, you don't need to keep going. As you said, the highly processed sugars, things like energy drinks that have like lots of hidden sugar in them are probably not great for skin.
For driving acne.
Hopefully teenagers aren't smoking, but avoiding smoky environments is also probably a really big environmental factor for worsening acne.
So we've looked at what the causes of acne are, what some of the myths are. We've established a bit of a simple routine. Do you have any red flags for when you go and seek professional help from GP or?
Yeah. So first of all, the confidence, which we were talking about before. If you notice your teen, or if you are a teen and your mood is decreasing, you're not going and spending time with your friends, you're not involving yourself in things that you usually love to do.
It's definitely a red flag.
It's really time to get help.
Yeah.
If you've got scarring starting to form, and there's plenty of kids that either don't notice or it doesn't bother them too much, but that can escalate quite quickly. So if you're starting to get scarring, get in to see a professional.
And we don't have a lot of treatments for that. So that's going to leave an irreversible mark, really.
It can do.
Yep.
And then if it's just really widespread, so sure, you might have only like fine little pimples and pustules, but if it's covering your whole face and your whole back and your chest, I think it's time to go and get a bit of help.
And I often have a magic number of 5. So I say to my patients, if you're getting more than 5 lesions after you've given it that time frame, then that's a bit of a marker that maybe you need to look at a different treatment option.
Okay, cool. if we were going to start, like, so you've gone to see your GP and you've got a good skincare routine in place, it's just really basic but doesn't have actives, what kind of things might be added in from there?
As a next step? Yeah, I think salicylic acid is one of my key cleanser ingredients. I think that does a really good job of unblocking or unclogging the pores when those little bumps start to form. So generally I advise that as part of any cleansing ingredient.
Okay.
I love some niacinamide in a moisturiser. I think that has a really beneficial effect with acne and in just promoting skin healing.
Okay.
And then making sure the sunscreen is there is really important for my routine. What about yours?
I think that's a really great starting point. So what did you say? Salicylic acid and niacinamide, which is vitamin B3, so really nice and soothing. If you want to do something a little bit more active that you can get over the counter, you could look at something like azelaic acid, and then you could start adding in some prescription products like retinoids or retinols to help, more used in the evening, and you could get prescriptions for things like that from your GP.
And work really well with adult acne too.
Absolutely.
Yeah.
Up from there, you're looking at oral medications, and there's a whole host of different ones that are available which may or may not suit you and may be dependent on any other medical problems.
And often have to be discussed with your doctor and in terms of the side effect profile and how long a treatment duration might be.
So if you turn up to your GP and we've now added active products, we've got some retinol or retinoic acid at nighttime.
Yeah.
And you want something oral, so you want a systemic medication. There's kind of a couple of different categories that you could look at.
Yeah, the step up from there is often drugs like doxycycline or erythromycin. So these are added in conjunction with your general practitioner or your dermatologist. They're antibiotics. Yep. They're looking at cleaning up that inflammatory side of things. Okay. So, when the pimple's quite red and angry and pussy, that's causing a lot of cell and skin damage. So antibiotics work to really dampen that down and quite quickly. But at the same time, you don't want to be looking at them as a long-term solution. So often quite a finite time period and using in conjunction with topical prescribed retinoids, so things that combine tretinoin with clindamycin as a nighttime routine, and they work really well to paralyze that little sebaceous gland unit so it doesn't overwork while you're cleaning up the any bacterial side of things.
So what would that defined period of time be? Like if you get put on antibiotics, is that 3 months, 6 months, 12 months?
That's quite variable with the patient and their skin, but I generally don't like seeing a patient on antibiotics for longer than 8 to 12 weeks. That's the sort of time frame that if that's not working, then I often are thinking of escalating to the next step. What is your next step after antibiotics?
So males and females are a little bit different. So if you've got females, we have a few more options in terms of hormonal control. So there's combined oral contraceptive pills and spironolactone, which inhibits the testosterone or that driver of the oil. So those are options, but they're specifically for females, so they're not for guys. And then if you've got males, the next step really from a medical point of view is medication called isotretinoin, which is been around for a really long time now. It
has now.
It's not without side effects, so it's very important to pick the patients, have the right group of people, have them really informed and well consented. But it is a highly
fabulous drug. It's really the miracle drug of acne, isn't it? It works by completely paralyzing that oil-forming gland so that the acne is turned off. But you're right, it does need quite a detailed discussion on side effects. And they can be dose-dependent or not, and how it's going to work into your lifestyle. But used in the right way, it's a game changer for acne.
Yeah, it really can be. I would say something that's really important to know, and maybe it's been popularized, it's not always a cure though. So yes, it's effective and people don't see acne return in what maybe like 75% of people, but there's a group of people that do get a small proportion, recurrent acne, and it will dampen it down, but then they still need other treatments going on in future, or they're happy with that decreased inflammatory load. So they're happy that it's minimised the scarring in this really significant time frame. I often, in my practice, we do a lot of what someone might consider aesthetic treatments, but are really medical in this sense. So we often do chemical peels, we offer laser treatments, and we even do certain types of microneedling treatments, which I found really effective for both people's acne and preventing scarring at the same time. Because as you said, scarring can be irreversible. So we try to manage that as it's coming
early
out.
and
yes.
yeah, getting there before it
Absolutely.
is too deep.
Okay, Kate, I've got some rapid fire fact or fads.
Sure.
Does eating chocolate and greasy food cause acne?
Fad.
Does sunbathing or going to the beach clear up active acne?
Fad.
The only way to treat a pimple is to completely dry it out. Fact or fad?
Oh, partly fact, partly fad.
Excellent. Sweat from a heavy workout triggers acne.
Fad.
And pimple stickers. Fact or
Love
fad?
them. Fact. Definite fact.
Excellent.
That's it for today. Hope you learned something. Make sure you subscribe.